There's my armpit, exactly. Hi, everyone. Nice to see you.
You should be like, hi, everyone.
So we were just kidding. I love to take selfies if you follow me at all. And I'm always have my right arm up. So we were just kidding about, they asked me to do something and I was going to show my left arm pit, which isn't my favorite armpit. So, just starting to show off that way is just the way to go about it.
That's funny. The bloopers, right?
Yes, all the blooper reels that you don't always see.
I'm gonna move that mouse over.
All right.
It will just disappear.
So we're excited. We're here today at RDHU. So it's been a long time since the three of us and the four of us have been together,
Yes.
really. So we're very excited to be here. Unfortunately, Anna Louise is not joining us today. She is busy
in Ottawa.
Yes, she's doing some education out in Ottawa way. So we do miss her. And she was very sad to miss you, Angie. She sends her regards and she was really bummed that
She's a raving
fan.
Yes.
Aw, that's so sweet.
Yeah, she mentioned she's been following you for quite some time. So yeah, she was sad to miss, but she's thinking of us and she'll be tuning in later on for sure.
Good thing we have the capability to record things at this point in time, right?
That's right.
Absolutely.
I know.
Yeah.
Well, we have a nice big crowd here to see you. Everyone's very excited to hear what you have to say. And we're excited about it as well. I won't take very long with just a couple little instructions here at the beginning. But we're live here on Zoom and we're also live on Facebook. So we have people tuning in from both areas. Just to help us make sure we don't miss something that you're either saying to us or asking. If you could put questions that you have into that Q&A that you'll see either on the bottom of your screen or the side of your screen, that would help us just organize everything. If you're just saying hi, use the chat function for that as well. We have a full program today, but we will be taking up questions as we go through. And as always, you'll be able to find the recording of this event. If you do have to step away earlier and you want to rewatch it or finish the end, you will find this on our website as well. As far as the CE certificates, those always come kind of after this has been uploaded, and that is in your member portals that you can get. Any questions you have about that, send us an email at info@rdhu.ca and we can certainly help you out with that. That is all I have to say. I'm going to hand it over to you, Kathleen, to introduce our special guest.
Thank you. And I'm just going to add to Beth's is that we will send out the follow-up email on Monday. So if there's anything that you would like us to send you, anything extra, then please feel free to ask us and we'll make sure that we include those extra resources, and then you'll get your certificate on Monday as well. All right, so I'm very pleased to introduce Angie Stone. Angie has begun her career in the United States Navy as a dental technician. Her assigned mission was to help keep her fellow sailors dentally ready for deployment. After her enlistment, she completed degrees in dental hygiene and psychology. Angie has worn many hats along her professional journey, including clinical dental hygienist, sales, and educational positions with dental product companies. Director of hygiene consulting with a leading consulting company and adjunct faculty in both dental assisting and dental hygiene programs. Editor-in-chief for a leading hygiene publication and director of hygiene recruiting for a recruiting firm. Wow, that's a lot. Each of her experiences were unknowingly preparing her for her next mission, serving elders. Angie's work with the elder population manifested when her mother-in-law passed away in a nursing home, likely from dirty teeth. As a result, she has spent the last 19 years focused on the dental health of elders. Through her company, Amazon best-selling book, Dying from Dirty Teeth, and lectures in 47 states and 6 countries. Angie has made an impact on how elders are understood and cared for by the dental profession. Her work in residential care communities exposed her to many patients with Alzheimer's disease. This and the fact her family is experiencing their 3rd generation of Alzheimer's disease. Angie's calling has pivoted again. After being told she has the gene for Alzheimer's disease and that there is nothing she can do to prevent her own diagnosis, Angie went to work to prove that there are things she can do. She now holds certifications as a brain longevity specialist, certified dementia practitioner, and certified caregiver. What she has learned is too important to keep to herself, bringing education to the masses of people regarding reducing the risk of Alzheimer's diagnosis is the next iteration of Angie's life work. She is hopeful her journey, pain, and learning will continue to help others. So thank you so much, Angie. That is quite the impressive biography for sure. And so I would just like to get started with, how did a dental hygienist become interested in becoming a specialist in brain health?
Kathleen, thank you so much for reading that bio. Every time I hear it, I'm like, this is what happens when you don't say no. Right?
I was winded.
Yeah, and so it's like there's all of these things, right? And I think that
Impressive.
we don't know where we're going to end up, right? And so when an opportunity comes along, my mantra has always been to say yes. And people are like, well, how do you do? I'm like, you just figure it out, right? It just figures out. And so, as you mentioned, my journey has just led me to where I'm supposed to be. And that's my belief, right? Once you see the, I don't even know if this is a word, the horrificness, it's a word today, of Alzheimer's disease, you can't help but be moved. And that's what happened to me. I'm like, there's something bigger than oral health. And we all know that, right? As dental professionals, we all know that we are taking care of one little part, but our one little part can have such an impact on all of the other parts of the body. And so this is a really great way of linking our profession with another realm, right? It's another part of the body. And as we'll probably discuss in a little bit here, the mouth is directly connected to the brain, right? And oral health is also affecting brain health. And so I'm like, well, it just makes sense, right? That dental hygienists are on the front line of brain health. And we don't think about it. And so because no one was talking about it and educating about it, I'm like, it just seemed to line up, if that makes sense.
Mm-hmm. Mm-hmm. So I know you're going to be talking a lot about kind of our role as dental hygienists, but I'm just curious if you could sort of summarize or kind of lead us in this direction, but why would a clinical dental hygienist discuss brain health with their patients? How would that kind of naturally occur?
Yeah. So thank you for that question, Beth. We, as dental hygienists, are always trying to get people to take care of their oral cavity, right? And we have in our armamentarium this oral systemic link. And we are big talking about the oral systemic link. And so what happens inevitably is that we default to oral health having an effect on our heart health, okay? And oral health having an effect on our, if we have diabetes or not, right? And so these are things that we've been talking to our patients about for a long time, how our mouth is connected to those two things. Also, premature low birth weight babies, right? So we talk to moms about taking care of their mouths. And yet we see patients coming back in and they're not serious, right? They're not serious about their oral health. And so we're on this mantra time after time after time. And I think that what we're telling people is like, okay, so I might not get heart problems from my mouth. And if I do, we can fix that.
Yeah.
Right. I mean, do you want to have stents put in? Do you want to have open heart surgery? Absolutely not. Is it available? Yeah. We hear about people having heart attacks all the time and they live, right? People live oftentimes. Think about diabetes. Okay, so if I'm diagnosed with diabetes, what's going to happen? They're going to give me some metformin and some insulin. I'm going to be good. Right? Yeah. So the messaging, when we talk about oral systemic health, in my mind, isn't strong enough. However, you start talking to people about their brain health being affected by their oral health, their ears perk up, their eyebrows go up. Right. And that's what we want when we're talking to people. We want their eyebrows to go up like, wait, what? Like that. Right. And this message, what I'm hearing from hygienists that I'm working with, when they give their patients information about Alzheimer's disease, they're listening.
Yeah.
Yeah.
Because guess what?
Nobody
Once
wants
we
that.
have Alzheimer's disease, are they taking our brains out and fixing them? Are they cracking our skulls open and fixing the brain? Absolutely not. Once it's done, it's done.
Right.
So now I'm hearing hygienists say to me, oh my gosh, Angie, this is such a different message. And my patients are listening because there's been surveys done that ask people, what disease are they the absolute most afraid of getting? Alzheimer's.
Yeah.
Even above cancer, above anything. Alzheimer's disease is what we don't want to get. Does that make sense?
Yeah.
Yes.
It really does. And the way that you broke that down, as far as just, as I call them zingers, it's like, you've got to make your patients think, and you've got to sort of have them, you know, attuned to what we're saying. Cause you're right. I never thought of it in that light. You know, you've got diabetes, you take medication, or you take a second dose, you take a this, you do that. There's so many options, but with Alzheimer's, there really isn't. And so can you help us? Because you've got such a great way with words, and I'm so fortunate I've met you so many years ago, but how would you start that conversation between connecting the brain and the oral health? Like, how can a hygienist bring this up confidently and concisely in their appointment to start this conversation with their patients?
Yeah. So let's do a little role play here. Okay. Or I'm going to ask you guys.
I
some
nominate
questions.
Kat. I nominate Kat.
All right, Kat, you've got it here. This is kind of like impromptu, right? But you can do this. So if you had, let's just go to a pregnant mom, right? A pregnant woman, and you wanted her to improve her oral health. What is the reason that you want her to improve her oral health? What do you tell her?
You tell her you want to make sure that the baby is being carried to full term.
Right. Because if that baby isn't carried to full term, what?
I know this answer already because I just watched your summer edition of the Dental Hygiene Quarterly.
Right. So let me, we'll back it up a little bit, right? Our typical conversation is exactly what you said, Kathleen, right?
Right.
And what happens is, again, the moms are like, nah, you know, if my baby comes out a little early, I mean,
It's
we're
okay.
really good at taking care of preemies for the most part. I mean, not always, obviously, but we're pretty good at that. And so moms are not all that freaked out about preterm low birth weight babies sometimes, right?
Yeah.
But if you tell that mother that if she pushes that baby out early, that baby's brain is not fully developed.
Mhm.
Do you think her eyebrows would go up?
Yeah.
Like, wait, what? My baby's brain?
Yeah.
Well, what happens if my baby's brain isn't developed all the way? Well, that child can have some neurological deficits, right? Not keep up in school, not have the same things as a baby who's been carried full term. So to me, that is a natural way to talk to our pregnant patients. And I have some other examples for other populations about brain health that they're not even thinking about, right? And so we trace that back. How does that involve the hygienist? Well, obviously, we want that pregnant mom to keep her oral cavity healthy so that she doesn't push that baby out, because we want to give that baby the best start that it can have. And we want that baby to have a brain that is fully developed for 9 months. That makes sense?
Yes. And I would just like to back up a little bit just to talk about how the brain health and oral health are connected. Because I remember years ago seeing your dad speak, and he was saying that, if I can remember correctly, but out of like so many brains that were examined, that 98% of them were full of spirochetes with the Alzheimer patient's brain. And so that's very, very impactful. So if you could just maybe explain a little bit about that, like what is the connection?
Absolutely. And so, as you said, Kathleen, we are finding particularly P. gingivalis in the brains of Alzheimer's patients. Okay. So we are finding that PG, TD, FN, and PI are the big culprits for Alzheimer's disease. And it appears that they use the nerve pathways in the mouth that are connected to the brain to get to the brain, and they can somehow cross the blood-brain barrier. So they're doing the same kind of work in the brain as they do in the mouth and cause inflammation. Okay. And then that inflammatory process starts in the brain, and it goes downhill from there. So we really want to do the best that we can. I just read something that said that's leading us to believe that the PG is able to wear down the blood-brain barrier a little bit and make it more permeable. Okay. And so they're able then to get through that BBB.
Wow.
And so when we're talking to our patients, again, I don't think that we and I have talked, you guys have talked to me about this, but there's a huge place here for salivary diagnostics, right? Yeah. Because if you don't know what's floating around in your patient's mouth, you have no idea how to give them this information, right? But just say that you do salivary diagnostics and you come back and they've got a high PG. It's like, holy buckets, right? That's technical term. Holy buckets, you better get this PG under control, because otherwise we risk you increasing your chances of Alzheimer's disease because of what's going on in your mouth.
Yes.
But if you don't know, right? If I just had that conversation with the patient, they might think, oh, I don't have that. How do they know if they have it or not if we're not doing salivary diagnostics?
Just thinking, Angie, do you have something like some sort of resource that, you know, somebody could print, like a dental hygienist could print, to be like as a reminder, like these are the talking points. These are the things that you can discuss with your patients about, you know, the highlights of what a dental hygienist should speak to our patients about.
You know, I don't have anything put together and prepared at this point.
Okay.
I have a little handout that I do give to hygienists, and it's just like the 5 ways to take care of your brain, right? And it just lists some things like sleep, obviously oral health. We can talk about sugar content in foods. That would be another place that I would put a conversation about brain health in when we're working with children and we're talking to their parents. We can talk about that if you want. But there are many ways, but I don't have anything put together at this point.
Yeah, no, I'm just thinking, because there's so many different things. I'm just thinking of all the different types of clients and patients that we would see. And then we could just kind of list them. So that's how my brain works. I think about ways to be the easy button, right? Just as a reminder to our dental hygienists, to our members, to have this such important discussion.
Well, I think Angie's already touched on a few good points. It's about looking at their biofilm load and amount, and talking about that aspect, talking about sleep, understanding that aspect, bringing in the nutritional component that we can really start a conversation with in that manner. And there's many more. So those could be almost 3 instant takeaways so far. And I know you're going to unpack probably 6 or 17 more as the session continues. But I do think that this is a really great topic, and an opportunity to have a different conversation with your patients, because they come in and they kind of, I don't know about you guys, but they come in, they're like, oh, same story. Okay, she didn't tell me to floss more, same story. Yeah. But if you have a different conversation, a different avenue, and a different message, I think your patients will receive it. And I think really post-COVID shutdown in all the countries, people are more open about health. They want to know what their risk level is. And so communicating risk level and reducing risk level and risk assessments and in this way to really help, I think will really drive that conversation and patient buy-in.
Yeah. And especially if you have Alzheimer's in your family, right? It's like that really opens up that discussion. It's not okay to have a little bit of bleeding. Yeah.
Exactly. Yeah, I have so many things I want to say. Really good comments. And Kathleen, absolutely. If you have Alzheimer's in your family. So I want to back this up just a little bit to what Carrie said. So when I was practicing clinically, I developed my own and did it on my own, a newsletter. It was just a 1-page newsletter, right? And I had a topic every 6 months. Okay. And it was just something very simple. And the practice printed it out for my patients. And that was the topic of discussion that 6 months. So every patient that came into my chair for 6 months heard this tidbit of information, right? And then in the next 6 months, they learned something else. And so my mantra was, it's like, if you're not learning something in my chair, then I'm not doing my job, right? And so there are so many things that we can talk to our patients about. And like Carrie said, it's like, you know, it's the same thing. It's the same thing over and over. And they just kind of like tune us out until they understand that they're going to come there and they're going to learn something and take something away with them. That was really powerful for my practice, right? The other thing I wanted to say is let's just hit on another talking point here. When we see a child, maybe like 2 years old, 3, 4, what is the one thing we're telling other than brushing? What else do you talk to that parent about to not have their children have a lot of?
Sugar and pacifiers and bottles and like depending on which section, that's usually where the avenue I'm going into is sugar conversation, sugar content, and making sure that they aren't using pacifiers or bottles anymore at that point.
Absolutely. Exactly. So the sugar conversation. Okay. We come from it, obviously, and we should, from a point of tooth decay. Okay. Yeah. Okay, my kid gets some tooth decay. Baby teeth, they're going to fall out. Do you hear that a lot? Oh, what else do we do if we get a cavity? We have fillings, right? Fillings are not like this atrocious thing to anybody but a dental hygienist and a dentist, right? The rest of the world feels like they just get part of their tooth amputated and we just pack it with something else and it's absolutely fine.
Yeah.
Right? So what are we doing here? It's like nobody is taking us seriously. Switch the conversation. So let's talk about sugar. Let's talk about tooth decay, right? Let's also talk about what sugar does to the brain. Sugar is very addictive, and sugar can have effects on our brains that we don't even think about. Okay. It can delay our reasoning. It can delay all kinds of things. It can make our children have feel like they have ADHD, right? And we're like, they're so hyper, we're taking them to the doctor. Let's put them on some medications. And oh, actually, it's because of the sugar, right? That's having these effects on their brain. And so there's research to show that kids should not have sugar. There's amounts, and I don't have them right at the tippy top of my brain today. But I have that information right in
21
my
grams.
PowerPoint.
21 grams.
Less than 21 grams.
How do you know this?
Basically a juice box.
A juice box.
Yeah.
So, I mean, how many of our kids are getting more sugar than a juice box? All of them.
Is it a juice box per setting, per meal, or is
Per
it
day.
like per day? Okay,
Per
let's
day.
just clarify that.
That does not
Per
make
day.
me popular at dinner parties, so I usually keep that little tidbit to myself. Angie,
Right.
you're really, it's interesting because you're hitting on, like what I'm hearing you say is it's like a different way of motivating our patients, like talking about make sure you floss, make sure you brush so you don't get cavities, conversations, not necessarily what's eliciting that motivation that we want. And what is interesting is as you're talking, you can tell that it's starting to elicit stuff in us as the dental hygienists. So just a couple of comments that are coming in, if you don't mind me taking a moment just to share them.
Have at it.
Someone was just, first comment was there was some interest in what you had developed with a handout that you had said you had.
Yeah.
Someone was just saying, if willing to share that, they would love to see it.
I actually had emailed that to Carrie, so I hope that
Perfect.
when
It's
you
in the
send your
after.
follow-up email, I
Perfect.
hope
Yeah.
that you can attach it to the email. It's there.
Yeah.
for
Thank
taking.
you.
We will send that out for sure.
Mhm.
What was the gene, like when you were diagnosed, what was the gene that they?
Yeah, so that was another conversation that I wanted to have based on
Okay.
Kathleen's comments, right? So we know that we get genes from each parent, right? One from our mom, one from our dad. So there is a gene called APOE. Okay. APOE are the letters. And you'll hear the professionals talk to us like APOE. They'll say APOE, right? But it's really APOE. Okay. So we get one APOE from our mom, one from our dad. That gene has a number attached to it. Okay. So it's a different expression. So you can have a 1, 2, 3, or a 4 attached to your APOE genes. Okay. So it's expressed as APOE 1, 1. So that means you got a 1 from your mom and a 1 from your dad. Okay. Or you can be a 2, 2, a 3, 3, a 4, 4, a 1, 2, a 2, 3, a 2, 4, a 3, 4. Okay. And the numbers are what matter. So we're thinking that being a 1, having a 1, it's pretty rare. Okay. And so well, I'm sorry. There's not a 1. It's 2, 3, or 4. As I'm saying that,
Okay.
that's not right. There's no 1. It's APOE 2, 3, or 4. Okay, back up the bus just a second. So the 2 we think that's a little protective. Okay, if you have a 2 or 2 2s, that's a little protective, is what they think. The 3 seems to be neither good nor bad. Okay. The 4 is when it gets interesting. The 4 is what puts you at a higher risk. Okay. So anybody who's a 2 4, a 3 4, or a 4 4, if a 4 4s have a really big risk. Have a really big risk. And I'm a 3 4. Okay. My dad was a 3 4. Our daughter's a 3 4. Okay. Interestingly enough, we all started out as 4 4s, like way back. And it's a fascinating conversation, but I think it's a little more than what we need to do today. But evolutionarily, these other alleles, or I don't know how you say it really, alleles, or the expressions have come along. Someone, I just saw the question in 4 4s higher risk for what? Alzheimer's disease. Alzheimer's disease is what we're talking about. So that's the genetic component for Alzheimer's. It's a simple blood test, does not cost a lot of money. If you want to know what your gene expression is, do not let your doctor talk you out of it. Okay, because oftentimes they do. I have students, coaching students that I work with, and they go and they ask, and the doctor's like, you don't need to know that. We're like, why not? Well, because it'll just make you worry your entire life. Well, how do you know that? You know what? For me, it empowers me because I know that I've got that risk sitting there. So I really try to be in tune to taking care of my brain.
I think it also, sorry, didn't mean to cut you off there. I'm like, I think that just knowing is powerful, and then you have a choice. It's the same thing with, you know, doing your periodontal charting and not actually doing it all complete. If you don't have all of those risk assessment and risk scores, you really can't come up with the right treatment plan. And so you can, you know, hide away and pretend that these things aren't there. But if you have a family history, I think it's only in your best interest to know, and then you can, you know, make choices or be aware of those situations for sure. Go ahead, Beth.
Just something that you were saying goes so well with one of the comments we had coming in, and you were talking about how you could take what you've learned and be fearful, or you could take what you're learning and be empowered. And there was just a comment that came in that I resonate with, and that's, you know, we don't want to be, this is scary. This subject matter is scary. So when we're talking to our patients, how do we turn it around so that, yes, we're able to talk about hard things, but we can have it as being a positive conversation towards the end of the conversation. So I'll leave that with you, because I'm sure you'll even talk more to that. But I liked what you had said.
So when we're talking about hard topics, right? I think we have to kind of like understand our patients a little bit first, right? And ask them, you know, ask them. Do we have on our medical history, do we have any questions about family history of Alzheimer's disease? Probably not. Do we have anything on our medical history that says, have you been diagnosed with MCI? Mild cognitive impairment, right? We don't have those questions on our medical histories. I had someone tell me we can't ask that. Like, what do you mean? We ask them everything, right? Do you ask them if they have sexually transmitted diseases? I mean, we ask them everything. Oh, we can't ask them if I'm like, yeah, you can. And the worst they can do is say, I'm not going to answer that. Okay.
That's actually one of my favorite conversations is when I look at their health history, it's like, okay, this is what you have diagnosed now. Now tell me about your family. What kind of diseases and things does your family have so that I can understand your risk? Because you may not have been diagnosed with it yet, but that could be part of your journey in the future. Let's figure out what those risks are. And I think that really resonates with making sure your medical history is up to date. If you haven't updated it in recent, these are two great questions to add to it, to just have as a conversation piece. And then again, your appointment shifts and changes. And then your audience, which is your patients, are like, whoa, she's never asked about that. That's different. Why? Why is this important? Why are you asking? And then they're asking us a question and we're like, yes, I'm so excited. Guess what you're asking for? We're going to figure out how to get you healthy. And this is going to be your journey. And this is why. And they just buy in. Anyways, I'm slightly excited with this topic as usual.
That's good.
It's good.
And then to reiterate what Beth said, to leave it on a positive note, it's like, just because you have a risk doesn't mean you're going to get it.
No.
Yes, thank you.
Right? It's just more information. And so I like to talk about it as bullets in a chamber, right? So I know I have 4 bullets in my chamber sitting ready to go off. Okay, because of my risk factors. I'm female. I'm postmenopausal. I have APOE. Okay, 3 bullets in my chamber. Okay. 2 of them I can't control.
Right.
I can't change that I'm a female, and I can't change that I'm postmenopausal. So those are already 2 kind of strikes against me. But the APOE, I can't change that either, right? I can't change those. I can't change any of those. But what I can do is manage my outside things so that I keep those bullets in the chamber. That's the goal, right? So that they are not being released and getting me to have cognitive decline.
This is really
So,
good, Angie.
that's
Taking
the
lots of notes
positive.
here.
Yeah, she is.
Good. That's the positive piece, Beth, right? It's like when
Yes.
we know we can do better. And
Absolutely.
we can take steps, and then taking those steps to take care of our brain ultimately makes our entire body healthier. So start at the top with your health and everything else will follow. We talk about healthy hearts, right? I'm here to tell you guys, I don't want a heart that's going to beat for 10 years after my brain is no longer operational.
No.
Yes.
I see it all the time. See it all the time. Nobody in that situation wants their heart healthy. They wish it would stop. Brains are more important.
One kind of follow up to what you were talking about. Someone was just one. So yes, we're going to be empowering our patients and talking about how we can kind of start to almost flip the script. But for those who really, maybe get information, get a diagnosis similar to what, finding out that you are genetically predisposed to something, is there any kind of counseling service or anything you've heard of along the way that might help with any fears or anxieties that kind of come up for these people?
I don't know of anything specifically except for talking to a brain longevity specialist.
Okay.
Right. Like I am, and talking to someone who's in the know about these things. The Alzheimer's Association can be good. They have some counseling and some things like that for people. Yeah, there's not a ton.
Okay.
Right? There's not a ton. Mental brain health. So I think brain health and mental health are 2 different things, right? So brain health, we're talking about the operation of the brain and the brain doing what it needs to do. Mental health is another thing. We're really good at mental health, or getting better, maybe not really good, but we're getting better at supporting patients with that. We're not good at supporting patients with their brain health. I just had a conversation with Ann Rice because I just went to the neurologist yesterday, and I had a conversation with her because I was completely frustrated. And she said, Angie, and I love this quote, and I'm going to use it. Our neurology prevention care is all needing to be self-paid for. It's not covered by insurance. Because I was asking questions yesterday and he's like, oh, insurance doesn't cover that. Insurance doesn't cover that. I can't tell you how much I've spent on learning how to take care of my brain, right? Because the medical community is not all about it. They will tell you once you have mild cognitive impairment, but they're not interested in keeping your brain healthy.
Mhm. So going off of that point and getting very practical to dental hygienists, how are you teaching people? Like, how are you helping people to take care of their brains?
So I, as a dental hygienist, obviously, if you were looking in the dental hygiene realm, the first place in my wheelhouse is periodontal disease.
What?
Okay. In my wheelhouse, my best wheelhouse is periodontal disease, salivary diagnostics, letting the people know what bacteria are in their mouth, and then helping them mitigate those bacteria so that we lessen the risk of the bacteria traveling to the brain and causing inflammation. And then that's when you start to get all the plaques and the tangles in the brain, okay, which causes all the troubles. So that's my space on how I'm helping my patients, other than just educating them. Okay. Also having those conversations and getting them to think about their brains. Wearing helmets when you're riding bikes. Talk to your children patients. You know, it's summertime. What are you doing for the summer? Oh, I'm riding my bike. Oh, cool. Are you wearing your helmet? Right? Kids hate to wear helmets.
We do.
And we know that helmets save brains. Okay. They
How
don't
about
want to listen to
omegas?
their parents. What's that, Cling?
How about omegas?
Omegas, absolutely. Absolutely. So if we want to talk about supplements, that's a whole nother, conversation. And I don't know, how comfortable hygienists are talking about supplementation with their patients, right? But conversations like, kids, wear your helmets, because I'm here to tell you that they trust you. They like you. They will take your opinion better than they will take their opinion of their parents, because their parents are nerds.
Yeah, parents don't know anything, for sure.
Parents don't know anything.
We don't know
No,
anything.
Nothing.
Right. But the healthcare provider that they see every 6 months, whom they know, trust, and like, they will listen to.
Yes.
At least if you're planting the seeds, right?
Now, you touched on a few other things as far as your takeaways. So definitely in our wheelhouse as dental hygienists is to talk about periodontal disease, assess it, evaluate it, reduce it, like mitigate it the best we can. You also we talked a little bit about nutrition. So sugar and having that conversation about wholesome foods goes a long way. We stay in our comfort zone, but starting that conversation, bringing in dietitians, nutritionists, things like that can also help, I'm assuming. But also sleep. You talked about sleep. I think that is also in our wheelhouse to evaluate, to look at. So maybe you can give us some tidbits from the dental hygiene perspective about what we should look for, or some nuggets of what we can say in order to help with this brain health conversation.
Yeah. So the one thing is, when you have your hands in your patient's mouth, they're a captive audience, right? They're not going anywhere. They got nothing else to do except for listen to you babble. So let's babble some good stuff. Okay. So how many times do we have a patient sit in the chair? Oh, how are you today? We say to the patient, oh, I'm tired. Right? How many times do you hear that? Cool segue right there. Well, how's your sleep? Right? Many offices are doing sleep medicine, right? Even offices that are not, you can have this conversation. So how's your sleep? Oh man, I'm sleeping like, I don't sleep very well. Oh, I might have some sleep apnea, or I snore a lot, right? That's one conversation. We can tie that conversation into brain health. Okay. And here's how. Our brain is cleared out of all of the toxins from the day and all of the junk that's getting into our brain when we sleep. Okay. We have something called the glymphatic system. The lymphatic system is the system with all our lymph nodes, and it's cleaning out and getting rid of, detoxing our body, but it doesn't work with the central nervous system. So it doesn't do the brain. So the glymphatic system is circulating in the background all day long, but the program is running really slow. When that program is at its highest peak is during deep sleep. That's why we need deep sleep. Okay, because that's when that lymphatic system is like really kicking out those toxins, okay, the inflammation. So I like to and we cycle through our sleep stages, right? Some of us never get into deep sleep and we wonder why we have brain fog. Okay, we have to sleep a long enough time to cycle through the cycles so that we end up with enough deep sleep, or we're not getting everything cleaned out. And I like to talk about it like this. Let's say that I'm going to vacuum my house today. Okay. And I start in one room and I'm vacuuming, getting all the carpets cleaned up. And then somebody calls me, my kid's sick and I got to go to school. Okay. The vacuum stops. And I come back and now I'm tending to my child and all the carpet didn't get cleaned because I didn't have enough time.
That's good.
That's with your sleep, right? You're going to sleep. You're starting to get into some good sleep. You're in deep sleep. All of a sudden, it's been 4 hours. I'm up. You didn't have enough deep sleep, dear. Your brain, and you do that every single night, your brain is not being cleaned out.
Yeah.
So over the years and years and years, no wonder our brains don't function well. So I know that's a long-winded way to explain it, but I think it really like paints a nice picture of that we have to sleep. Most of us need 8 hours of sleep a day, depending on your age, but most of us on the call will likely fall between 7 and 9, 7 and 8, 8 and 9. I'm still at 8 and 9. Okay. But in our world, we like to say, oh, I don't sleep much. It's like,
I think that that's very fascinating. And I know I've had that conversation with patients, like how long are you actually giving yourself to repair? How long are you, giving self-care, and self-care is sleep, and trying to, I know we've had conversations, and Rice and I've had conversations about, the consistency of when you go to sleep. Your body has a rhythm. And so, it's not bad to say as I say to my kids, it's 10 o'clock. I know you may think you can stay up later. That's fine. I have to go to bed because I cannot function if I don't get a really good 7 hours. I'm like, you don't like mommy tomorrow. You know this. We've had this conversation. I'm like, getting in those consistent conversations. And this is something that in dental hygiene, we can bring forth is that importance of assessing and having that conversation. It really is something that's so powerful.
I think
That's
so
why
too.
I love my Fitbit. So every night and my husband, like, we're not together this week and we always message each other our sleep score. So like mine was 81 last night, his was 84. So we celebrate, it's like, it's one of those things that you can see how your night was and how much deep sleep you got. And then it tells you, like, there's a benchmark for people your age and it tells you where you're fitting in, and it's very helpful.
Super helpful, super helpful. And we don't have great sleep hygiene either.
No.
We should not have any kind of lights in our bedrooms at all. Nothing, darkness. And if you can't do that, you sleep with a mask on.
Yeah.
I have a
Because
lot
your
of
brain does not turn off completely until it's dark.
So for a Christmas gift for all the people we really love and care, we should be giving them masks.
Yeah.
Sleep
Okay.
mask.
Okay.
Yes.
And
So if you get one of those
Absolutely.
for Christmas from your friend or from your dental hygienist, say thank you. Don't go like, what are you doing? I'm actually caring for your brain health and I'm
Yes.
encouraging you to have a good sleep. Okay.
Absolutely.
Can we brand with
Absolutely.
RDH, please?
yeah, I love that.
Yeah,
Yep.
for sure.
And no blue lights.
No.
Yes.
Stay off your devices 2 hours before you go to bed.
2 hours.
You're taking away all my fun, Angie. I'm just
I know.
saying,
I know. And if you're not going to do that, you need a blue light blocker.
Yeah.
Yeah.
Yep. And it should be
For the
quiet.
classes.
I mean, you think about the cave people.
Yes.
They were in the dark. They were in a cool cave. You
Yeah.
need it cool. It should be 66 degrees when you're sleeping.
And when you're working in a gown and an N95, okay, it has to be chilly at work too. Let's be honest. Okay. The front desk people may need a parka, but us in the back need to have it cool.
Yes.
Day and
We'll
night.
just tell people to help our brain. Okay. There we go.
Absolutely. Yeah.
Angie, with a lot of like just the research and everything that you've been doing with sleep, have you come across anything that would suggest using something like a melatonin or some of us when we're desperate, Benadryl, have you read that it affects that deep sleep at all?
You know, the information about melatonin is all over the place. You know, some people say it's fine, you can use it long term. Some people are like, do not use it, right? I think it's all about a lot of it. And women that are menopausal also have trouble with night sweats and things like that. I think really getting to, if that's the case, our hormones are out of whack. Right. And so getting to someone who can work with bioidentical hormones, right? Or I've been reading a lot about that lately too. So the sleep aids aren't, something that I would recommend long term. And sometimes we need them, right? Because we need to sleep. But I think before we do that, we should look at our sleep hygiene, right? Getting that circadian rhythm to know when you're going to bed, right? And when you're waking up, and force yourself to go to bed most often at the same time and get up at the same time. And you will be interested to see that really we are centered around the sun, right? We're not intended to be up working until midnight.
Yeah.
But some of us are
Again,
like,
I
oh, I
didn't quite
never
hear.
sleep,
Can
I
you
work.
tell me one more time? We're not supposed to be up to midnight. Wait,
in the back.
Yes, we're not supposed to be up to midnight working. Okay.
No, because you need to have your brain wind down. So most oftentimes the reason we can't sleep is because our brain is still thinking about stuff. Oh, I got to do that tomorrow. Oh, I didn't get that done today. Oh my gosh, I didn't pack the kids' lunch. Oh my gosh, nobody has clean underwear for tomorrow. I have to get up and do a load of laundry, right? I can't send my kids to school with dirty underpants.
Yes.
So it's like, there's just so many things that we don't pay attention to that we're like, oh, something's wrong. Yes. And we have to figure out our rhythm, our sleep rhythm.
And meditation helps too, I think.
A lot.
Yeah.
A lot. Yeah. And there is a 12-minute meditation that's great for brain health. It's called Curtain Kriya.
Really?
Super amazing. 12 minutes, Curtain Kriya. They call it KK.
How do you
And
Curtain
KIRTAN, Curtain, KRYA, I believe. You can Google it.
You can
It's
add
for
that
real.
to,
Yeah.
we'll add that to the follow-up with your handout that you have, because that way then it gives them that opportunity to share that with people, because I think having a moment to meditate, to slow down before going to bed is or just in general in life is so important. So can you tell me a bit more about being a longevity specialist? What does that look like? What is the goal of that, and how does that help the dental profession?
Yeah. So for me, okay, it was a logical step in my journey. Okay. So my dad, my great grandmother had Alzheimer's, died from it. This is all on my dad's side. My grandma had Alzheimer's disease. Her brother had Alzheimer's disease. They were generation 2. My dad passed away just over a month ago from Alzheimer's disease. His sister is in the throes of Alzheimer's disease, and their baby sister was just diagnosed with mild cognitive impairment. And working with all these people, I ended up doing my oral care services mostly in memory care communities. Okay. And so between that and then my APOE4 status, right, 3-4, I was like, I got to do something because nobody is helping me here. The medical system is not set up for that. So I went on a search and I'm like, what can I do for myself? And there's a certification called Brain Longevity Specialist that I took online, and then also done some other work following some other folks in the industry, and really understanding that there are things that we can do. Okay. Like things that we've been talking about. Okay. Sleep is huge. Taking care of making sure we're not getting a ton of sugar. And so my work at this point in time is helping people to understand how to take care of their brain. That's what a brain longevity specialist does. And the hope for that is that we can at least ward off any cognitive decline, push it out further for diagnosis, right? Or hopefully not get it at all. Okay. And people are like, oh, Angie, you can't guarantee that. I'm like, no, I can't guarantee it. I can't guarantee no one's going to get cancer tomorrow or get hit by a truck. right? But we live our lives as such that we have hope and we do the right thing, because if we don't have hope and we're just running around all nilly-willy, you know, what do you got? You're just living in fear. Okay. And so I am working with people. I have a program that they can purchase and go through. And then I have a lot of hygienists, obviously, that are taking that course. And then they're taking the information to their families, to their patients, to, you know, to their out in their world. So that's
And
another
don't you
one.
have a Facebook group that people can join? Can you
I
tell
do.
us a bit about that?
I do. It's called Alzheimer's Risk Reduction. Okay, Alzheimer's Risk Reduction. It's on Facebook. It's for free, and you can just ask to join. And I will approve you to come on in. And I will tell you that the information that I've been putting out has been lacking as I'm working through my dad's last few months of life were horrific. And I was his primary person. And so I've been through the ringer. And so I'll tell you that there's not a lot of posts that have been up currently. However, I'm the engine's getting started again. Okay. And this
Nice.
conversation today has really been helping me to get fired up again about what I'm doing, because it can be very lonely.
Aw.
And especially, you know, just when someone dies and you're trying to live without a dad. So just be patient with me, but there's really good stuff there. If you look at the older posts, there's a lot of good stuff there.
You
There's
always
more
have
coming.
such great information, and we really appreciate all that you've done for your family, for the community. And you take as much time as you need, because when you come back, the information you'll be able to do and how you've inspired so many people and have changed their family's life and everything else is just, you know, you can't count it. But it is really very, thank you for all that you've done, and take as much time as you need. We're very sorry to hear about the passing of your father.
Yeah, for sure.
Thank
And I
you
think
so
that
much,
what,
ladies.
you know, what you're doing, and, you know, we just had a few comments coming in, just wanting us to say thank you to you just for doing what you're doing, because you've been very personally impacted by this, but so many people have as well. You've done something with it, and you're now inspiring all of us to do something with it. And that is just incredible to be able to use, you know, your platform and what you've built to help all of us. So thank you so much for that. Kath, I know that we wanted to share a little bit. We wanted to kind of show everybody how to access the wonderful book that many of us know who you are because of this book. And Kath has a couple of things that we want to go over with what's coming up next.
Sure.
But just before anyone had to leave, we just wanted to make sure we had said to you that not only are we as the RDH view grateful for your time, but so many people are just leaving comments right now saying how inspiring this has been. So honestly, thank you.
4 pages of notes here.
Yes.
So can I just do a quick summary of some of the talking points for the hygienist? And then you can help us fill in the gaps and see if my copious, my penmanship is terrible. So I have to see if I can read some of the notes. But main number 1 is talk and figure out diagnosed periodontal disease. Figure out what's going on in that section. If you can add testing to it, great bonus. Look at sleep, have that conversation. Look at nutritional health and everything else, and your medical history. Make sure you're at least asking about their health, but better yet, have that family history conversation. And if you're personally looking at opportunity and understanding your own risk, talk to your doctor about having the blood work done, the blood test done, doing your genetics, figuring out all of your vitamin deficiencies and all of those. So you have that data and that information. And yes, it probably is not covered by insurance, but invest in yourself so then you can better help your patients. How's that for a summary? That
Amazing.
Yeah,
like an A+? I was paying attention. All right.
A+. One thing I want to say is if somebody really wants to know their APOE status and they go to their doctor, and the doctor is giving them fits about it, you can do it on your own. You don't need a doctor.
Really?
Okay. So there are labs, especially, you know, in the States. I would think that there are labs in Canada that you can go to. And if you have, I mean, I would help you with that, and it's not expensive. So if it's something you want to know, you have a right to know.
And there's those private clinics too that we have in Canada.
Mhm.
Yes.
You can go and get it all done.
For sure.
Yes, for sure.
You should
All right,
read- you should
so
read
Kath is going
Nancy's.
to share. I just wanted to let you know, someone had sent the
Good.
message just to say that they've known you for years and been following you and have your book, and that now they're in nursing homes weekly. So, you
See
know,
how many lives you've
Yeah.
touched?
Yeah.
It's amazing. Like I'm goosebumped again and a bit teary. It's like, thank you for sharing this message. It's
Mhm.
amazing.
yes.
Well, I think that if we have pain in our lives, there's no purpose if we don't do something good with it.
Mhm. Well
Yeah.
said, well said. All right, we're just going to finish off today. Kath's going to just walk us through what's coming up next. So just give us a second, we'll get that going.
All right. All right. So here we have the lovely Angie Stone. Is that
I'm just gonna read that for you.
okay? All right. Should I hit something else? Do you want to just hit them? So this is the Dying from Dirty Teeth, and you can get this on Amazon. Is that correct?
Yes, ma'am.
Perfect. Okay, that's your book. And I'll send a link as well with the follow-up. This is the Dental Hygiene Quarterly. It's our on-demand professional development. And so every quarter we offer about 3 hours of professional development. And Angie Stone happens to be in the summer 2023 edition. You and your patient's brain health, what you can be doing now. And it is fabulous. So if you're not a member, we'd love to have you join. It's $199 Canadian. Or if you're a CDHA member, it's $149. And then you just use the promo code CDHA and you'll get that discount. And that is the trap sheet here of Angie's. All right, so just as an FYI, we have lots of experiential hands-on programs here at RDHU. We're actually at RDHU right now in Burlington, and we just finished the myofunctional therapy program on last weekend. And we had dental hygienists coming from BC, Saskatchewan. So we love when we have, our own province, our own members here, but also when people come from all over Canada, it's actually so amazing. It makes us very happy. Ortho, instrumentation, sharpening, and more. We've got the experiential, what is it? The oral cancer and oropharyngeal cancer workshop that's happening in October, right? So, and then tomorrow, we just had a couple people that couldn't make it. So we have some openings if you're around this area. We have a day for you and your team. It's a free day. It's sponsored by RDHU and by Creston Oral B. And it's about global power, it's sustainability. And also I talk about the 8 simple secrets to growing your practice. All right, live streaming, what we have for June, we have Dr. Jim Highland, who happens to be Carrie's dad, and Carrie Lepacek, and they're talking about all things halitosis, and that's a 1 hour on June 19th. We have Mysteries of Myofunctional Therapy. This is the 6-hour program, so it's not the full practical program, and this is a prerequisite for the full program. So if you're thinking about myofunctional therapy, becoming a myofunctional therapist, you'll want to start here. And also if you're just interested in learning more about it and how you can work with a myofunctional therapist, this can actually be very beneficial to you. And then, of course, the lovely Danny Botbill doing her virtual ultrasonic coaching. This is part 2. It's all about curved inserts, so the left and right. And between Danny's feedback with her virtual coaching and what we hear from our members, absolutely love the virtual coaching. Just the hands-on, you get to really visualize, and it's just been a very positive experience. So that's happening on June 16th. Oh, and I put this in here just because Beth and I are going to Finland, and we leave on June 15th. We're going for a week. We've been invited by LM Dental as their guest. They have dental hygienists coming from all over the world. We're the 2 Canadians going. I think there's 3 Americans going. Someone from Czechoslovakia, Germany, Spain, Italy. So super excited. They're taking us on excursions and a couple of saunas as well. And of course, the hands-on workshop. So we're really excited to come back and bring on new material to share with all of our members.
Kathleen,
Yes.
can I stop you for just a second? Are you going to
Yes.
see Ansi?
Yes.
You just, if you remember, tell him that I said hello.
I will. Yeah, he's the best.
Yes.
Yeah, he will be there. I think there's 15 dental hygienists and about 15 of the LM people that work with them that will be there. So it's gonna be a
That's
nice
awesome.
group.
That's awesome.
Yeah,
Have a
so
great
super
time.
excited. Yeah, and that's assured.
All right.
So our next
you.
RDHU show, we're taking the summer off. We hope that everybody has a wonderful break if you're able to do that. And then we will be reconvening in September, from September to December with our next show. So definitely, we've got quite the lineup already set up. So definitely make sure to watch out for those emails on the On Track Tuesdays to know when to sign up for that. But that'll be starting mid-September.
Perfect. Yes. All right. Again, thank you so much, Angie. And thank you to everybody for spending a part of your Friday with us. We know it is absolutely beautiful in most parts of Canada, as far as we know right now. So thank you for spending the time with us on this lovely day.
Thank
And
you,
have a
you
great
guys.
weekend.
I'm honored. Thank you so much. Have a great weekend.
Thanks, Angie.
Bye, Angie.
Bye. Bye,
Bye.
everybody.